Hello, and welcome to this episode of the American Academy of Optometry podcast series, where I'm joined with Dr. Messner. Dr. Messner, give everybody a little bit of a background on yourself, your practice history, really what you do on a day-to-day basis.
Sure. Well, first of all, thank you, Dr. Brujic, for your very generous invitation to participate in this podcast and spend a little bit of time talking about optic neuritis. I'm currently a professor of optometry at the Illinois College of Optometry. My clinical practice is limited to individuals with neuroophthalmic disease. While I have a lot of administrative duties, I do spend a significant amount of time seeing patients. At the end of the day, and I know that you're in the same boat. I think that seeing patients is what grounds us. And, I have an additional advantage of being able to train students, residents, and they keep you on your toes.
That's great. And I will tell you, when I think about an individual who's best poised to talk about this next article, I think it's you. So the article we're going to be talking about is Clinical Predictors in Acute Optic Neuritis, Analysis Based on Clinical Trial Data. So if you could kind of give an overview of this study and why it's important to us in the trenches.
Sure. So a lot of what we know of optic neuritis and the natural course of the disease goes back over 30 years to the optic neuritis treatment trial. There was a North American trial and has had numerous publications and evaluative, secondary evaluative studies over the years. This study it was a study that was conducted in Germany. These were individuals with clinically isolated syndromes as optic neuritis. So by definition, these were individuals that only had optic neuritis. They did not have other findings of multiple sclerosis. They were all tested for NMO spectrum disease. None of them were, if they were positive for aquaporin 4 IgG, they were excluded. The one thing that was not tested in this study was for MOG IgG. So that may be a slightly, so the study may be slightly limited because of that omission, but I don't think much. This is a secondary analysis of roughly 103 patients that were originally part of the TONE study that was used to determine the effect, if any, the neuroprotective effect of erythropoietin for individuals with optic neuritis as a clinically isolated syndrome.
So when you think about that, what was found to be the most consistent clinical predictor of visual outcomes 6 months after an acute episode of optic neuritis?
Yeah, that's a great question. And much of what was reported in this study is the equivalent of what was reported through ONTT and other optic neuritis studies throughout the world. And the three main predictors of poor visual outcomes 6 months down the line were older age, male gender, and poor initial baseline visual acuity. And you may ask yourself, well, what exactly is poor baseline visual acuity? Historically, and going back to ONTT, I think most of us have looked at that as 2200 or worse, that those individuals may do poorer ultimately as it relates to their visual outcomes as compared to individuals with better baseline visual acuity.
So when you think about the data from this study and how it'll affect our patient education in the future of optic neuritis research, what do you think the implications of this data are with respect to those factors?
I think there are a couple of things, Mila, and one is that, certainly a patient has the right to know the likelihood of visual recovery, regardless of what is being done for them. So I think that articulating these findings, that if you are older, if you are male, if you have poorer than 2200 visual acuity at baseline with optic neuritis, and specific to this study as a clinically isolated syndrome, that means effectively it's only involving the optic nerve, nothing else, or nothing else yet, is that you have a slightly your visual prognosis is not as good as if you didn't have those things. Nevertheless, we know that all comers, if you look at the optic neuritis treatment trial, 92% at 15 years had 20/40 or better visual acuity. So I think that we largely look at 20/40 as being a pretty well-functioning individual. So even those individuals that did not recover as well, most of them did. They may not have been to 20/40, but they still showed some visual recovery. However, there were those that did not. And certainly, I think if those three categories, older age, male gender, poor baseline visual acuity, are things that you need to take into consideration. Now, going back to some of the criticism of ONTT, and I think that the same can be applied here, is that when you talk about older individuals and men, and the other thing that was delineated in this study as a poorer outcome measure was that if their nerve fiber layer measurements were thicker, meaning that they had optic nerve swelling, significant swelling at baseline, that those people did worse. Now that calls into question, was this really optic neuritis? Was it really optic neuritis as a clinically isolated syndrome? And specifically, are you really sure that it wasn't non-arteritic anterior ischemic optic neuropathy? Now, that was a criticism of ONTT, and as the authors of this study brought up, a similar criticism can be levied here. However, I do think that more has the technology is better now than it was before, so it may very well be that if you're older, if you're male, that you have a higher risk of not recovering vision, as well as someone who doesn't fit those categories.
Dr. Messner, you have a great way of taking the complex and really kind of digesting it down for us so that clinically, if we do see these patients, we do have better communication pearls with them. And I feel that makes us more effective as well, too. So thank you. Thank you.
But I would add, that should not be a doom and gloom predict. Most individuals with optic neuritis show significant recovery of visual function. It's just that this cohort, older age, male, poor visual acuity at baseline, they may not recover as well. And unfortunately, some do not recover at all.
Great. Well, Dr. Messner, thanks again for joining us on this episode of the podcast. We truly appreciate you taking time out of your busy schedule to be with us.
Well, it's truly been my pleasure, Mile. Thank you for your invitation.
And thank you all for joining us on this episode of the American Academy of Optometry podcast series.